Hello and welcome to Max Your Tea episode 3. I'm Teddy Draper, a broadcaster in the UK. Most importantly, though, we have two GPs on the call. Dr. Katy Draper, a GP in the northeast of England. Max Draper, also a GP in the northeast of England, but now a testosterone specialist. And if you've seen the first couple of episodes, you'll know that this is really a podcast that's grown out of Max's travails following testicular cancer and now working as a testosterone consultant, expert, guru, aficionado, whatever you want to say. Katy, Max, how are you doing? You well?
Good. How are you doing?
Very well, thank you. Very well. Good to see you both. And obviously, there's so much nuance and detail we can get into around testosterone. But the first two parts, if people haven't seen them, are documenting Max's journey really from testicular cancer through ill health to low testosterone. And now we're going to get into more broader general topics, which I think Max and Katy vicariously through living with Max is now kind of very au fait with the details of testosterone. And we're going to look at what is low testosterone broadly today, Max. I suppose rather than diving into test scores and numbers and things, should we look at some general symptoms that would alarm you if someone presented them to you? What should we be aware of if we're wandering out there, whether we have got low testosterone or maybe should investigate it?
Yeah, I think there's a variety of symptoms that it can be sort of linked or causative of. To put the simple ones would be, changes with your erections and reduced libido. Those tend to be the ones that seem to be commonly associated with a low testosterone. I would kind of group it to make it easier for people almost to go sort of head to toe, really. So you're talking about mental changes. So particularly common one seems to be brain fog, which is almost like a terminology to say, look, you just can't seem to think straight. You can't seem to your memory's not as good. Just things aren't working as clearly. So that would be one that I see that quite commonly, really.
So libido is an acute drop off rather than a kind of gradual decline as we get older. Is that what you'd say? I don't know, Katy, if people come to you, what men would say, how you quantify that, because you don't normally count things like erections, I guess, or most people don't.
Well, I think that, Max is right. The most common reason people present related to low testosterone is with lack of libido and then decrease either in morning erections or not being able to get an erection when they're having sex. So those things are the way.
When they're having sex, it's just in the middle of it.
In the middle of it.
Oh, yeah. Well,
in general.
Kind of a roadblock, isn't it? Yeah.
Those are the common things that men would present with that would say to a GP, they might have low testosterone. Those really are the things in our head, which would be the only reason we would test for testosterone in men. It would be those symptoms, and that is one of the most common ways that they present, but it is not the only way that people present with testosterone. Hence, going from a bit of a head to toe and going through the symptoms that you can have is important, because that wasn't actually how Max presented.
No.
He didn't notice a huge change in that way. It may be a little bit, but not. It wasn't the main problem that you had. Your things were more reduced exercise tolerance, like we've talked about in the other podcasts, brain fog, depression, anxiety, and the repetitive thoughts that he had. That was the way that you and the
which I suppose is difficult, because if you went through an acute illness where you would have naturally been less than optimal in terms of your mental clarity and things like that. So it's trying to discern how long you wait after something like an acute illness like testicular cancer before deciding I'm not yet back to normal operation, and what normal operation was before you were ill.
Yeah, I think it's quite hard with testosterone, because my story is quite acute. You could talk about it dropping from losing a testicle in a period of a few years, and then perhaps meningitis had an impact as well. But with a lot of guys, these will be quite gradual changes. It won't necessarily be that they have an acute, for example, like brain trauma or testicular injury. That can happen, but often it's more of a steady decline. And then it's almost as if it's very likely that they hit like a threshold where they no longer have the, floating around testosterone levels sufficient to feel sort of good. And that can gradually occur. I mean, it won't be sort of one day to the next, all of a sudden, not like, you contract the flu or something. It's going to be a very gradual thing. So it can be quite hard to look back and judge it because these will be gradual changes in a lot of cases. Mine was much more acute based on the fact that basically I lost half of me
I think so.
factory.
I think so as well. Looking at the age, look at the age of the man.
Yeah.
And the other medical conditions that the person will have. So if you're an older man, naturally your testosterone levels do decline after the age of 30. I think it declines, well, the NHS think by 1% a year, but there's lots of evidence that it can decline a lot quicker than that.
Wow.
So if you're looking at an older man, it's likely that naturally his testosterone levels have declined, and that'll be a gradual process. If it's a younger man, it can be related to lots, it can be caused by lots of things. But looking at the other problems that they have, so if they're type 2 diabetic, they're much more likely to have low testosterone. If you're obese, you're much more likely to have low testosterone. And then there's lots of medications as well that people are taking for blood pressure, cholesterol, antidepressants. So you can be presenting with low mood, be started on antidepressants. If you've got a low testosterone, a lot of the antidepressants can then lower that testosterone further, which adds to the problem. So it's not a simple this is the symptoms and that's what you've got. It's a collection of lots of data about the individual.
Yeah, how dangerous is that, Katy, as a general practitioner yourself, I guess, before you knew all this deep dive on testosterone, about presenting is the overlap between depression and low T, and how they can be misdiagnosed? Is that a big problem or a challenge for doctors?
Yeah, I think so. I just think because GPs, we're not trained in what low testosterone is, really. I mean, there is no nice guideline for GPs on treating low testosterone. The guideline is actually based around erectile dysfunction. That's when we would test somebody's testosterone. There isn't a guideline, and when you're looking at causes of depression, to add a testosterone in to check. There isn't a guideline in type 2 diabetes that you should check testosterone, but the BSSM guidelines do recommend anybody with a high BMI or type 2 diabetes to have a testosterone checked. So GPs just don't know. So they don't know what to check for. So hopefully some GPs and our friends might listen to this, and obviously we educate our own practices. So our practices are probably better at it than others. But also maybe the person themselves need to listen to this and say, right, yeah, I identify with those issues, and I'm going to tell my GP what it is that I need checked, just in case.
Yeah, prompt them as well, because GPs, as we say, the clue's in the name, isn't it? General practitioner. There's a lot to kind of to root through on a daily basis, and a lot of symptoms presented. Max, how do you define the mental fog? How would you describe that? Because I think a lot of us, again, it's similar to the sort of low mood stuff that we could anecdotally say, oh yeah, I suffer from that. Like everyone had COVID during the pandemic because the symptoms seemed so kind of common, didn't they, in terms of what they are. You could say, oh, I've got mental fog, I can't remember people's birthdays, but maybe there's an accumulation of sort of mental space decreasing as we get older with more things to consider. Is it something that you noticed acutely that was a very thick fog that you couldn't work through? How would you define it?
Yeah, because it's quite a vague term, isn't it? So, I mean, for me, it was very much just a lack of clarity of thought, and just really inability to sort of mentally function, as sort of vague as that sounds, really. A lot of what guys will describe will be, it is almost like there's a fog in their mind where they just can't think as well as they normally would be able to in the past. They can't sort of formulate their thoughts, and a lot of it is, I'm just not as sharp as I was. A lot of people will say in business at work, they're not as the clarity's just gone, and they're not as sharp, they're not as quick thinking, they're not able to sort of do those little calculations that they just bang out day to day very normally back in the past before symptoms started to progress. I think part of that mental fog can often be linked with the depressive side of it, or the sort of apathetic feeling that you can get.
How does motivation fit into it? Lack of motivation.
Yeah, I think it's all part and parcel of a very similar process that's going on within your brain when you don't have those sort of sex hormones that you really need for everything to function well. Depression, anxiety, poor sleep. So it's a bit of a vicious cycle there. Mental clarity. It all kind of comes to varying degrees to the chaps I see. Some guys will have very bad mental fog, but they won't have any anxiety or very little anxiety. Some guys will be, really down, but, sleeping okay. It's very variable. So that's why it is quite a difficult one to say, if you have this, this, and this, you're going to need to get checked. It's very much just an overall picture, which is why I kind of like seeing an expert can be helpful, and that can be hard on the NHS. Like you said, GPs are generalists, and testosterone just isn't taught. It's literally not taught. I mean, the NHS website on the andropause, for example, seems to imply that it doesn't quite exist, which is quite impressive.
So they do. So there's more on menopause than andropause, is there, in terms of the general practitioner training?
Yeah, there's a wee bit on menopause. But as a male GP, I don't see a lot of menopausal women. They do tend to self-select to females. You see a lot more menopause than me, don't you?
Yeah.
There's probably a reason for that. I guess maybe empathy and things like that, probably easier to understand. But Katy, what's interesting to me is how you discern the root cause, because people, again, might pick up on these symptoms, but presumably if you're going through a stressful time in your life, not sleeping, etc., whether it's baby, shift work, is there people could maybe pause for thought and think, actually, I can try and adapt the lifestyle before I panic and press the low T button? Do you think that's a big one? And maybe it's if your life is otherwise not hugely stressful, you think actually this might be a deeper issue.
Yeah, I mean, I think when people present, they're often at the end of their tether. Especially, we find men tend to present later to general practice than women do. Just as a general rule, men tend to leave things for a while until it's at the breaking point till when they present. So I always say when I'm teaching my trainees, if it's a man with a problem and they've come in, you really need to listen to everybody. But usually they present later. So that would be one thing to consider. So often they do come in with, like, men come in with a lot of symptoms that have got really bad.
Yeah.
But you've got it's holistic, isn't it? You've got to look at everything in somebody's life, and you go into a GP, and GPs technically have 10-minute appointments. I mean, I never seem to manage that one. We don't even bother in our practice. We have a minimum of 15 minutes, but it's still not a long time to be able to go through everything about somebody's life and have a look. Are you stressed? What's happening at work? Are you sleeping? What's your diet like? How are you feeling mentally? How are you feeling physically? What other medical conditions do you have? What other medications are you taking? Looking at everything as a whole. Do you drink? Do you smoke? You're looking at everything, trying to bring this big picture together, and you've got lots of different ideas in your head of where this could go. It could be low testosterone. It could be thyroid problems. They could have weight loss or not be able to gain muscle, and that might be a more worrying symptom that need other investigations. And then you've got to look at all of the body systems to see what's happening. So this is not an easy, you've got that, it's low testosterone, but you can easily add a low testosterone onto the blood test you would do for a man presenting with these symptoms.
The debilitating effect of the feeling of having low testosterone, Max, is kind of another cautionary tale in terms of healthy lifestyle, isn't it? I mean, we look at type 2 diabetes, all the consequences, and we've looked at heart disease with obesity and things like that. But actually, this is a pretty powerful reason to live a healthy lifestyle. So before we get to a low T state, if we are, challenged in other lifestyle factors, or we're living an unhealthy life.
Yeah, 100%. I think the modern life is kind of geared towards getting people overweight and unhealthy. But in a sense of, it also affects your testosterone levels. There's a lot of, it's pretty confirmed that people's testosterone levels are dropping, quite dramatically, really, even in the last 20, 30 years. And there's a couple of studies that do cite that.
Which we talk about, I guess, in due course. We'll do an episode maybe on the hypotheses of why that might be happening.
Yeah, 100%. I mean, obviously there's lifestyle and environmental factors in there as well. What I would say about low testosterone, which is what I think is a big message to people, and it's probably not well known even in general practice, or even probably endocrinology and things, is that low testosterone is a bad marker for longevity. It's not just that it causes symptoms, it's actually a sort of risk factor for different diseases, and that includes, probably heart disease. So low testosterone is linked to the development of heart disease over time. Dementia, there's even research suggesting it's an independent risk factor for dementia. Diabetes is a massive one. low testosterone impacts how well your body deals with glucose, so insulin sensitivity. And again, there's studies showing that if you give men who are approaching diabetes testosterone therapy, if they're kind of low or borderline testosterone levels in their blood, that reverses things, or at least improves things. It's massive. There's osteoporosis, so thinning of the bones, anemia from low testosterone. There's all sorts of things that really we're not well versed in knowing, because we've just not been taught it or not looked into ourselves. I was, fortunate in speech bubble, speech marks, to suffer from it, because it really inspired a lot of research. But it is crazy. I mean, low testosterone itself is basically just a bad sign for your long-term health span and longevity.
I think it might be easier sometimes to determine if you're living an otherwise healthy lifestyle. Like you said, that you previously exercised very well, tried to eat well, didn't drink a lot of alcohol, etc., in the healthy spectrum of body mass index. But your connection with exercise is interesting as well, isn't it? For people who would think, who are listening to this or watching this and thinking, I'm actually living a healthy lifestyle, but I'm feeling terrible. Is that more significant in a sense? And the exercise component, how you feel when you exercise, when otherwise you should feel good if you've had the right rest and the right nutrition.
Yeah. I think that baseline lifestyle is a really interesting, debatable area as well with testosterone. So, because if someone is not living the ideal life and then they turn out to have a fairly low testosterone level, what do you do then? Because you could argue with a low testosterone, you don't have that energy or exercise tolerance to make the changes that will improve your hormonal health. Or you could say, well, rather than committing to lifelong TRT, why don't you try and make the lifestyle changes? But it is a bit of a balancing act, because it is a case of, well, do you feel too rubbish to make these changes? Because we know it affects motivation.
Exercise was making it worse to a point for you, wasn't it? Whereas previously exercise had been, like to a lot of us, a very kind of powerful mental medication for you earlier in your life, whereas it became a deteriorating effect, didn't it? A deleterious effect.
Yeah, it just kind of made me feel more zonked, more just sort of almost on edge after exercise.
You said sore legs or heavy legs when you're doing aerobic exercise, is that right?
Oh yeah, massively. Yeah, basically all my sort of, in hindsight, my muscles were really pooped. Really, they were just sort of just constantly felt like I was coming off a flu or coming off a really heavy session, which at that point was a rarity that I would lift much or lift for very long. My workouts were like sort of 20-30 minutes long, and I was like, yeah, this is me done. Like, I feel rough here.
Did you notice that, Katy, a physical diminishment in what he could do, what he could put out?
Yeah, because he talks about it all of the time.
Yeah, he did seem like crawling up the stairs and stuff like that. Or
as well, he's sleeping a lot. We all know about Max's sleep habits. But Max has always been somebody who, like I said, he's been up early and he's always exercised every day ever since I've known him for over 10, 12 years. You've always exercised every day, and you won't be able to exercise every day.
15 years.
That's a long time.
Yeah, I remember him running in the garden up and down the steps as a kid. Yeah.
Well, he's always been active. Yeah. What happened was you stopped being able to gain any muscle, which was something, and you gained more fat. Now, I didn't notice this at the time, but around his tummy. And I was looking at photos of him, and I don't have that many when we were having that really bad time, because most of the time he was in bed. So I really have I've got a few photos of him in bed, actually.
Yes.
We weren't out and about though, were we? Like you were sleeping a lot, but I saw that I put some on our Instagram account just to show the difference in what Max was like. And I know it's kind of difficult to see because they were just the photos I took at the time, but he seemed to put a bit of weight on around his tummy more, and he wasn't getting the gains he wanted, and he would talk all the time like, I don't understand, I'm doing this, but I haven't got the energy back, I'm not getting the gains I would get.
Yeah, how important is it for partners to notice it as well? Because I've hosted men's health events in the past, and often you see women pop up there as well, I guess on behalf of men in their life that they're concerned about. You don't ever really see that the other way around. Men don't know whether we're less caring or not, but we don't go to women's health events, presumably because women are better at marshalling themselves in that sense. But is it important for women to be aware of that, men in their life, whether it's partners, whether it's fathers, whether it's uncles, whoever it might be?
Yeah, absolutely. Often, anybody's partner, but when men come in, they'll often be with their partner and say, oh, they made me come to the GP with something. And it's often the partner that said to them, you need to get this sorted because this isn't right. And again, because I do think in general, just from my experience, I don't know what evidence, like I said before, men don't come to the GP as much, and they do. When they do, it is at the last straw, or because they've been forced to by their partner to go, you know, and the partner will sit there and say, right, this isn't right. He's doing this, this, and this. You know, we need to sort it.
So often, it's funny because often Carla will say to me, you need, this is a problem, and you go think, all right, is it? Yeah, okay, fair enough. What do we do then if someone's listening to this, watching this, Max, and they feel, oh, these symptoms are resonating, whether they've got broadly a less healthy lifestyle and feel this way, or whether they've got a healthy lifestyle and have noticed a dip in energy, mental fog has accumulated? What do you think they should do? Go to the GP, and what's the argument like? Because, or the conversation, I shouldn't call it an argument, because we had a chap get in touch early, David, who's had a kind of protracted situation with his GP where he's trying to get hormone replacement, but they're not actually recognizing the low T. What's that initial conversation like when you go to the general practitioner? How would you approach that if you were Joe Bloggs?
Yeah, so I think if I had symptoms of potential low testosterone, let's say, because obviously a lot of things can overlap. So if I had a series of symptoms, one thing you can do for guys listening is fill in something called an Adam-Q score online. There's some evidence to suggest that's quite well correlated with a low testosterone blood result, because it goes through a list of sort of researched questions that if you tick enough boxes, it might indicate that, definitely get a blood test. I think if you were going to see your GP, I would like you to be fairly armed with your own knowledge, basically. So what I mean by that is, if you go along and say, I've got this, this, and this, I would like a testosterone level done, morning level. What's the sort of guideline on the BSS? It's 7 till 10 a.m.
Yeah, so the GP guideline and the BSSM guideline is different. The GP will just check, and hopefully they'll do a morning sample. They should do a total testosterone, and it needs to be done between 7 and 11 in the morning. So an early morning total testosterone. And if that is borderline or low, the GP then will do extra investigations, which include an FSH, an LH, and a sex hormone binding globulin to work out the free testosterone level.
And would the GP also test for underactive thyroid and things at this point as well, other marks, which presumably is people, we shouldn't get sort of too locked into the testosterone diagnosis as well. If people present with those symptoms, you want as many things to be investigated as possible.
So so the GP would probably do a host of bloods, looking at your full blood count, checking that you're not anemic, looking at your inflammatory markers, looking at your kidney function, your liver function, checking your sugar levels, that you're not diabetic, checking your thyroid levels. So there's a whole host. They can also do vitamin D levels. I'm sure Max will be thrilled to talk about vitamin D at some point, because that's very important. And they can look at your other like B12 and folate levels. All of these things that can cause the general feeling tired all the time symptoms is what us GPs would call it, the general tired all the time, not feeling right. So the GP will do a whole host. The problem is that the guideline in GP for testosterone testing is not as good as what the BSSM guideline is. Basically, without a free testosterone level, your total testosterone doesn't mean very much, because you could be binding all of that testosterone.
So how much you got spare, effectively, is how much testosterone you have spare? Is that the key?
Yeah, so I would describe it. So you make your testosterone, most of it comes from your testicles. And then what happens is most of that testosterone is bound to a protein in the blood. So either SHBG, which by name sex hormone binding globulin. So that attaches quite tightly to testosterone. And then another proportion of it will be bound to albumin, which is a lighter bind, let's say. Now, the free testosterone is usually about 1 to maybe 2.5% of the total, okay? And that is by far the more bioactive testosterone. That's the one that goes around the body and tickles those androgen receptors and actually does what testosterone does. Now, the stuff that's bound is probably, it's wrong to say it doesn't do anything, but it's far less active than the free. So if you came and saw me and you had a total testosterone, let's put, of 25, as a GP, I would say, wow, you've got great testosterone levels. You know, your problem is not your testosterone. Now, lo and behold, you could have an SHBG of say 200, which is like really high, and you're binding all of your testosterone up, and you might have an incalculable free testosterone.
So what are the two key scores for everyone to just be aware of then with that in sense of looking at their test results? Will you get that in a test result from a GP on a regular blood test? You'll get both scores?
Not necessarily. So that's the problem. So if you go armed in with what you want them to do for you, say, I'd like you to do my total testosterone, but I'd also like you to do my sex hormone binding globulin and albumin so that you can work out my free testosterone level, please. That's
sex hormone blinding. And I suppose it'd be
SHBG. Yeah.
How would a GP receive a patient doing this in your experience, Katy, from the people you work with? Do they like sort of driven? Because you also, I'm aware as a GP from the other perspective, will be getting people with, dare I say, a bit of hypochondria coming in and self-diagnosing on a lot of things now with the internet.
Yeah. It depends what type of practice you work in. So for me, my practice, I work in a very deprived area. So my patients are not the type of patients who will have access to research things. And so for me, that doesn't happen. When I've worked in less deprived areas or more affluent areas previously, it was quite common for people to come in with things they'd read. Now, I don't mind people reading things because you can go through it with them. And often people find out things that I don't know. And I'm like, yeah, that looks good. I'm going to take away what you found and work out what's happening, and I'll get back to you. So different GPs are different. I never minded it. I did mind when someone's read something in the Daily Mail and they've decided that type of thing, and I've decided I need to immediately stop all the medication because I'm gonna die. That was more difficult.
Sure.
But yeah, different GPs will receive it in different ways. But I think if you just say it in a way that I'm concerned I've got low testosterone, but I've done my own research and this is what I believe we could do. Is that okay? Because the GP has access to these types of tests, and it doesn't take any more for them to tick one more box.
Yep. It's interesting. As someone working in the media, I mean, I work in the sports media, but you do have to be a little bit aware, particularly in the internet age, the attention economy and the clamor for attention in the media, that perhaps things can be a little bit more salacious and sensational in the press than maybe it would be in an academic paper, and take a more considered piece, and don't panic about what you read necessarily there. Max, in terms of when you're going through this process, should you be amending any lifestyles after speaking to GP? Should you amend lifestyle issues before you can, if you can? Because obviously if you're sleepless due to a newborn baby, it's very difficult to do that. But if it's something you can control, kind of drinking, whatever it might be, should you do that before you go to a GP, or should you do it as part of the process?
Yeah, I think that's probably a bit of a personal sort of decision to make yourself. I'm a bit of a testosterone fanatic, so I would argue get it checked at the beginning, and then if it is kind of borderline low, which you'll see a lot of, you could maybe instigate the lifestyle changes and then repeat it down the line. That's probably a logical way of doing it. I suppose it's an interesting one with testosterone and lifestyle, because it's basically just doing things that perhaps you should be doing generally for a wide variety of health metrics, and that includes, I always say, in order to optimize your testosterone, you're basically optimizing just your lifestyle, and that includes exercising, eating a healthy diet, avoiding probably processed stuff. Sleeping is a huge one. Not drinking too much alcohol, and stress management. But that's the same with everything.
Mental health, physical health. Yeah,
100%. So if you're not already doing that stuff, then you could argue get your levels checked and then repeat it down the line and see if you had made some headway.
Sleep is an interesting one as well, because you said you were sleeping a lot before your testosterone replacement, but the quality, the texture of the sleep wasn't good. It wasn't actually recuperative for you. Is that something that people could think about? Because actually, if you are burning the candle at both ends and not sleeping, maybe get yourself a few good nights and see what difference that might make. And if it's still not right, then perhaps that's another indication. It's not just the volume of sleep, it's what the sleep's giving you. Is that something that you found?
Yeah, absolutely. I mean, sleep is paramount to a lot of health metrics, but testosterone is a big one. I mean, there's a study that's you can see on PubMed, where they post a lot of studies. It was young, healthy men, and what happened? What they did, was for 1 week they restricted their sleep to 5 hours, and their testosterone levels dropped on average something like 10 to 15%.
Yeah.
Which is quite significant. I mean, I wouldn't say in the modern era that 5 hours sleep is necessarily that bad sounding. But
no, a lot of people stay up till 1 a.m. on their phone and then get up at 6 for kids and school, etc.
Yeah, 100%. So, again, even sleeping an hour, 2 extra might make a significant difference. I mean, 10 to 15% could take you from 12 to, now my maths is 14, 15, which is, a jump, isn't it? Is that
yeah,
1.2 would be 2.4. Yeah.
There's something like that. So it can make a significant difference. And then if you compound that fact, that's just 1 week of sleep deprivation they studied.
Yeah. But you were sleep. But the point being, I was trying to make, you were sleeping, but it wasn't helping you. That was a big significant thing, wasn't it? It wasn't an adjustment you could make because you were asleep a lot of the time, but it wasn't working for you, the sleep.
Yeah, I suppose the difference there maybe is the fact that my testosterone deficiency wasn't a prolonged lifestyle hit, whereas a lot of guys out there will probably be feeling the effects of a relative deficiency in testosterone from prolonged lifestyle sort of choices, or, choices may be a harsh word, but lifestyle effects over a prolonged period of time. So mine was kind of, I've one wheel on a bike, I've got one ball. I think the meningitis maybe had an effect on the messenger system of the brain. And so I was...
You're a unicycle, are you? That's what one wheel bike is.
One of those ones where the guy stands on it and just I couldn't quite get a hang of it, kept falling off. I mean, I think that the difference there is if you've had testicular injury, trauma, something like that, you might not be able to optimize your lifestyle to improve your testosterone levels. If you've had brain injury, if you've messed up your pituitary gland through trauma, infection, illness, medication, there's only so much you can probably do with your lifestyle. But a lot of what we see is almost comes under the branch of functional low testosterone, which is day to day you are doing things or what's the word? You're basically not optimal. So this is more of a lifestyle effect. So you can probably got more wiggle room to improve things. Again, where are you starting from, though? Have you got to a point where you are feeling so rubbish that those lifestyle changes are almost impossible to make? A lot of the guys I see are like that. It's kind of like, and a lot of them are doing a lot of the right stuff, but it feels like rubbish. And actually, they're just lacking the hormone. And you can't always diagnose exactly why. You can rule out the bad stuff. You want to rule out certain conditions, but a lot of the time it's just like, right, well, you just need that optimized. You just need your testosterone level brought up and you'll feel great. And a lot of the time they do, which is why I'm so crazy hot on the subject.
Yeah, and I think, Katy, just to round it off as well, if you've got your test scores back and the GP is quote unquote happy with it, says you're normal levels for testosterone, but hasn't maybe tested for the free flowing testosterone, how important is it to be persistent? Obviously, this comes sometimes a matter of budget as well. People could potentially look private. Do you think it's something worth fighting? Because as Max is saying there, motivation is dimmed when you've got low testosterone. So you may have less resilience to persist nagging your GP in the nicest possible way.
Yeah, I mean, I think it depends again on how normal is normal. So if it's borderline low, the guideline is they should repeat it anyway with a free testosterone. That's the GP guideline. So you'd be wanting to have a look at what the actual number was, and then you could say, but I know that actually because it's borderline low, that I should can I have a free testosterone done as well, please? If it's well up into the normal range, your options, I mean, you could ask again, is to try maybe some of the lifestyle changes, try optimizing your sleep. If you're overweight, trying to lose weight, trying to exercise, doing those things first, maybe giving it a period of time like you've suggested, and then going back and saying, I've done these things, I'm trying really hard. I still don't feel much different. Is it possible at this point then we could check up free testosterone? And I think that, I would definitely be receptive to that, but I would have been in the first place because of this. But, that would be the way, or pay privately to have a blood test on yourself.
Yes. And how expensive is a private blood test? Is that, I don't know what you're looking at for that.
Yeah, I mean,
how much is it through? I can't remember.
There's different companies. There's an online lab one, for example, called MediChecks, and I think if you wanted to get there's different types of screening done. One is a erectile dysfunction screen, which includes a testosterone, and I think it might do a free testosterone as well. And I think it does a couple of other things. And I think that's about 40 quid. I more thorough investigation from experience might be somewhere in the region of 150, 200, I would guesstimate.
Yeah.
You know,
which if it's revealing and illuminating on your health issues is pretty powerful as well, isn't it? It's one thing I wanted to quickly touch upon was the nuance of individual variability, which may explain why, if you've checked off thyroid, if you've checked off depression and all these things, and you actually had cognitive behavioral therapy, didn't you? And it didn't yield any big results in terms of your mental clarity and anxiety, etc. If you've ticked off all those boxes but your score is right and your free testosterone seems okay, is it a case of maybe there's an individual nuance where maybe your regular base level was a lot higher than the average? Because I suppose by nature doctors deal in averages.
Yeah, I mean, so just to tell people listening about this, sort of just briefly on the range. So if you get a total back and it's either below 8, that's significant. That's pretty, diagnostic of an issue by most people's guidance, because there's no actual international agreement on what low testosterone
Well, is it 1 to 30 typically a scale of testosterone in terms of the numbers that people are looking for?
Yeah, in different regions of the country, there's slight variability. So it can go from 6.6 to 30 total. And then, like I said, up here, I think my lab, the GP lab that we use, says something like 8.8 to 30. That's kind of under the heading of normal. Free testosterone is slightly different. So you're looking low would be 0.18, borderline low, which is when I would sort of be interested, is somewhere like 0.225. But what I'm getting at is if you get a borderline result, which the BSSM, we keep saying that, it's the British Society of Sexual Medicine. If you get a result between 8 and 12 on your total, they would consider that to be borderline and, quote, possible testosterone deficiency. Now, as someone who's done a lot of sort of reading and research into this field, you can't put a line on it. You can't say to me that a man with a level of 12.5 total is okay. That's, his issues can't be testosterone, because we know. I mean, this is not that I'm making it up. It's not bro science. We know that we know that the thing that testosterone needs to do anything, that floating around testosterone is not doing anything unless it attaches to an androgen receptor and invokes a change, which then affects your genetic, sort of your epigenetics. So we know that those androgen receptors, based on genes and probably lifestyle as well, but your genetics, the sensitivity of that receptor can vary from man to man.
Yeah.
At least 3 different changes on the genetic coding for your androgen receptor, which can dictate how much testosterone you need to feel optimum. I'm using testosterone as the broadest statement, because there's also DHT and there's another one that is called an androgen. So that androgen receptor also gets, affected by your DHT much more strongly, actually. But what I'm saying is, we know that this is not sort of in scientific debate. We know that androgen receptors can have different sensitivities. So drawing a line in the sand to say you're 12.5 total, you're fine, is rubbish.
Yeah, and it'll be what your body's, I suppose it'll be what your body's used to, Katy, because when you're a young buck and all things are even at 25 and you've got a score of 15, going down to 12 probably isn't catastrophic. But if your normal level as a young man was 28 and you're 14, that might feel horrible.
Yeah, well, I remember when you had yours checked before, literally you had it done just after you'd had your ball removed. And it was 22, something like that. I remember,
something like that.
22 is total testosterone. And then when they were checking it and not treating him, it dropped down to about 12 when they wouldn't treat you. Which he should have been treated at that point, and that was when he was really, really unwell. But again, the NHS is saying no, that's still above, the 8, so he's still in the normal range. But knowing what his normal was before, that's a huge drop from that.
Yeah.
So he had all of the symptoms. Yeah. And if you've got to look at both. It's not just a one where you can't diagnose testosterone deficiency on just a free testosterone, but you're looking at it alongside the symptoms. So people have the symptoms of low testosterone and they have a borderline result that can be diagnostic of this testosterone deficiency. You see? So
absolutely. It's what
a picture. It's not just the symptoms. It's a picture of it's both together.
And guidelines are guidelines. The names, the secret's in the name. You don't have to. So there's a private physician who kind of, to be fair, it sounds like I'm slagging off people for not knowing this better, but to be fair, I've done like 2 years of pretty solid research in it. So, and a lot of these people are generalists. You know, I don't want to have a go at endocrinologists who do a lot of the testosterone therapy in the NHS, but they are primarily diabetologists nowadays because there's so much diabetes, it's rampant. So what I'm getting at is really to do this potentially well, you know, and it sounds like I'm boastful, but potentially well, you've got to spend a lot of time on it because it is very nuanced. You know, there's no sort of hard and fast guidance. You use the guidelines as a kind of general idea of where you might say this is a deficiency issue, but if you have all the symptoms and your level comes up 10% above the so-called guideline level, but you've got all the boxes ticked on the symptoms, would you argue that you were?
And you've ruled out, as you say, you've ruled out underactive thyroid, you've ruled out vitamin B12 is interesting because vegans may be aware, you know, that's not something you can get outside of animal products. So if you are a vegan, it may be something you look at vitamin B12 supplementation and things to boost your mental energy and your sort of motor neurons and things. So that's another something I hadn't considered, but there are other things. Once you've ruled out those, you've ruled out depression. I suppose you could do a cognitive behavioral therapy analysis, couldn't you? And things like that, the questionnaires, which would possibly pour sort of insight into your mental health. So once you've ruled it out, then perhaps it's the last thing remaining. You go back to the testosterone and keep it up.
Yeah, I think if you get a borderline result, then look at the rest of it and really look at it and really have a think about what you can improve and what you can't really, you know, and then potentially just do your own research. I think that's the issue in testosterone is you need to do your own research, sadly, a lot of the time. Well, hopefully this podcast helps.
Yeah. Well, I was going to say, write some questions below because on YouTube you can do that. And I think maybe you can do that on Spotify as well. So if people have any comments or any problems they're going through the analysis stage, we can always respond to them. Or Max can. I'm probably not much use unless you want a football scenario or something.
The other thing is our Instagram and Facebook. I'm better on Instagram. We were just starting it, but we're responding. If anybody wants to send any private messages or comment on any of the things, we're trying to just put some simple bits of education on there just to help men identify what the symptoms are, whether they might have it, what to do with it. So but bear with us because
what's that? Are you doing well? Max your T, is it Max underscore your T? What's the handle for Instagram?
Yeah, it's Max underscore your underscore T.
Okay. Brilliant. And you can write obviously comments on the Instagram, some brilliant statistics on there and quite alarming actually about the amount and the kind of frequency of low testosterone in the population. Max, Katy, thanks for now. We're going to do the next episode, which will be up in the coming weeks as well, will be about how you go about getting testosterone therapy, different options as well, and lifestyle stuff as well. So speak to you soon, team. Thank you.
Thank you.
Bye.